We're going to cover what you need to understand about dizziness. Now, for many of you, dizziness is very, very frustrating because you're not getting better. You go to the provider and you feel like they're not listening to you. You feel like people aren't diving in deep enough to help you get better. This is for you. We're going to walk through what it looks like being a dizziness patient, why isolated approaches don't work, as well as what about those inner ear crystals that everyone talks about? Do they matter? Are they overblown? Should they be completely ignored? As well as what are other things that you need to understand about dizziness? Now, the very, very first thing we are going to establish is dizziness versus vertigo. A lot of people use dizzy and vertigo interchangeably. They will say, well, I'm feeling dizzy, or well, I've got vertigo. Well, what do you actually mean by that? The definition absolutely matters. If you are not defining this appropriately, and if the provider you see doesn't have you define it appropriately, then guess what? Odds are you are not going to get the right care. Dizziness may mean I feel lightheaded, I feel off balance, I'm unsteady. Maybe there's a shifting motion side to side, rocking forward and back. Whereas vertigo is more of a rotational issue. Then with vertigo, you have to break it down into, are you spinning or is the world around you spinning? Because guess what? Depending on what's happening, that tells us something different. And based on what it tells us, that should lead to a different evaluation. Now, this early part, we are looking at purely dizziness. Now, for those of you that have dizziness, you've had it now long enough that you're getting frustrated. And so what do? You go to your provider of choice. Maybe that's your primary care provider. Maybe that's a chiropractor. Maybe it's a functional medicine provider, naturopath, whoever it is, right? You go, and most people in the dizziness arena, they are going to start off very, very simple. And unfortunately, they often leave it at this. They're going to say, well, you've got dizziness. Are you hydrated? Are you drinking enough? What about your blood sugar? Are you eating enough? So they'll often do finger pricks and test your blood sugar. If you're at the ER, they'll also look at your blood sugar. They may look at your blood pressure. So these are the big things people look at: hydrated, blood sugar, and blood pressure. Now, the next step some people go to, unfortunately not as many as should, is they say, well, do you have medication side effects? So are there meds impacting you, making you feel lightheaded and dizzy? Right? Different blood pressure meds can do it, different cardiovascular meds, propranolol, metoprolol, and way more than that can actually make you feel dizzy and off as well. But on the other side, if they think you're dealing with vertigo, guess what? They're going to talk to you about those ear crystals. And you may end up ultimately at a physical therapist or somewhere else who's going to screen you for that. Not all primary care providers are going to do the screening for it. They'll often punch you to another place because it's just not their area that they really focus on. So we're going to dive into understanding what these ear crystals are. Are they really an issue or not? Because at the end of the day, when we look at dizziness or vertigo, the definition of what you have, it absolutely matters. And there's a wide variety of things that can contribute to either your dizziness or your vertigo. So when we look at this, dizziness and vertigo at its core is always a brain-based issue, always 100%. Your brain has to be negatively impacted for you to have dizziness or vertigo. Maybe that's because your blood sugar is too low, your blood pressure is too high or too low, right? Maybe it's because medication's impacting that as well, right? Maybe there's iron deficiency, but at the end of the day, there are things that are impacting your nervous system function, ultimately your brain health. When we look at dizziness from a neurological perspective, you ultimately have to have things going and working well in your brain to not have dizziness. So what does that look like? Well, dizziness is about connections within the brain. It's about energy. It's about inflammation. And it's about vascular, so blood flow and oxygen. All of this stuff is going to impact whether or not you have dizziness. Underneath how your brain's connecting, this is eyes, vestibular system, which we are going to talk about that because most people are not familiar with the vestibular system. But when they talk about the inner ear crystals, that's what they mean. But please do not get too fixated on the inner ear crystals because there's way more to the vestibular system than just that. Next, we have joints and muscles. So we're going to put cervical, okay, because issues with your cervical spine also can contribute to dizziness. So all of these, your eyes, your vestibular system, and your cervical, all have to provide good information to your brain to not have dizziness. Next, things that impact energy production and utilization can contribute to dizziness. Things that contribute to immune system dysfunction, inflammation, drive dizziness. And lastly, things that impact your cardiovascular system, how well you deliver blood flow and oxygen to tissues, also is going to play a big, big role in dizziness. Now, what I want to focus on first is your vestibular system. And I'm going to go in a bit of detail on this. I've already done another video and podcast looking at dizziness where we worked through the vascular, the immune, the energy, and stuff like that. Go back and watch that one if you haven't, because this one really is going to be deep into, can we stop blaming the air crystals for everything? When we look at vertigo, the question is, are you spinning or is the world spinning around you? Because within your vestibular system, you have a central and you have a outer component. That's known as the peripheral vestibular system. So when we look here, these are what we call semicircular canals. Okay? Semicircular canals are the peripheral aspect of the vestibular system. So anytime you move, right, if I turn like this, I'm activating my horizontal semicircular canals. If I'm going back, I'm activating my posterior canals. If I'm going down, I'm activating my interior canals. Now, a lot of people, where it's the ear crystals, that's called benign paroxysmal positional vertigo. It's most common with the posterior canals. So they will test you by bringing you back, saying, okay, does that make the world spin around you? Does it last briefly, 30 to 60 seconds? If so, then there's an issue with your ear crystal. And we ultimately want to take it and reposition you to get that ear crystal to kind of loop around and to go to the exit. Now, this is the peripheral aspect of the vestibular system. Now, but once again, there's so much more to it than just that. So this is the brainstem. All your peripheral, right? So when you move, this is going to fire in to your central vestibular system. So you have different vestibular nuclei, okay? That they live right here in the lower part. So you have your mesencephalon, your midbrain, you have your pons, and you have your medulla. They primarily live right here in the lower pontine area, okay? So the pontomedullary area, there's 4 different nuclei. Okay, we're not going to break all those down and what they do, but ultimately, this fires in here. This then is going to fire up, drive eyes to do certain stuff. It's also going to fire down to have stability within your neck and your spine. So you can have vestibular system issues that drive your neck issues, drive spinal issues. But on the other side, guess what? You can have neck issues that come up here and negatively impact your vestibular system. You can have visual issues that negatively impact your vestibular system because your vestibular system takes in information, sends it, got to be controlled, and that's ultimately how your brain processes things. So once again, do you have vertigo? Yes or no? Well, is the world spinning around you? Well, yes, it is actually. When I put my head in a certain position, then, and it only lasts 30 seconds. So that very well may be a peripheral vestibular system issue. Now, if it's lasting a lot longer than that, then you can have infections and other things that damage your peripheral vestibular system that can cause it as well. But a lot of people who are dealing with dizziness from a POTS, postural orthostatic tachycardia syndrome, dysautonomia, concussions, whiplash injuries, strokes, and other things like that, even issues with mold and things like that, they don't have a peripheral vestibular system issue. They have a central issue with their vestibular system. Once again, what did we say happens with your vestibular system? Your vestibular system feeds up, right? And you end up getting some issues with the eyes, right? So we've got vestibular reflexes. So if we move our head to the right, our eyes go to the left. We also have spinal reflexes as a result of our vestibular system activation as well. So we're going to put spinal. But we also know spinal issues can impact vestibular system function. We also know eye issues can impact vestibular system function. So if you are dealing with dizziness, vertigo, and you've done the basic stuff, your blood sugar looks good, your blood pressure looks good, you don't have medication side effects, you're hydrated, you've had the inner ear crystals treated, because here's something I commonly see, is the inner ear crystals were part of the issue. So this gets treated, it's part of the issue. But they're still not feeling good. They still feel off. And it's because you have more than a peripheral vestibular issue. You have a peripheral plus a central vestibular issue. You have to treat it all. Now, the best ways to really evaluate the eyes is to use computerized testing known as video oculography, video nystagmography. With balance testing, use computerized balance testing. But then there's also things that can be done for the cervical spine. So there's some of you who've done chiropractic, like, man, I get my neck worked on and I feel great. I'm no longer dizzy. Cool. That means your aberrant, bad spinal input is playing a big role. But for others of you, you get your neck worked on, you get adjusted, you get a massage, you get dry needling, and you're like, that was horrible. I felt so bad. It's because guess what? This was not the issue. Okay? You have something else driving poor spinal tone and function that makes you feel bad. And this is why getting a proper evaluation is so, so important, because if you try to make something everything, hey, if it's an easy thing, then guess what? You do well. But if it's not easy, you don't feel well. So this is what you really need to understand from a neurological perspective when we look at dizziness and vertigo. Well, does the nervous system live and function in isolation of the rest of the body? And the answer is no, it doesn't. So what is going to impact our nervous system's health? We have energy production and utilization. So what are things that impact energy production and utilization? Well, things that impact blood sugar. You need to know where your fasting blood sugar is, but you also should know where you're at a few hours after you eat. If your levels aren't back to pretty much a normal range 3 hours later, there's an issue. You also should know about your triglycerides. You should know about your insulin. Okay? Those are all things that are going to impact you. Next, we need to know about thyroid function and health. Thyroid's a big issue that also is impacting a lot of people. Get a good thyroid panel, TSH, T4, T3. free and total, T3 and T4. What about iron studies? This is more important in females than males, but even in males, I have seen this. Where's this at? Not just a serum iron, not just a CBC, but ferritin, iron saturation, and other things like that. What else? Hormones. What about testosterone? What about estrogen? These also are going to impact energy production utilization. We go into foods. Are the foods you're eating, are they inflammatory? Are they helping you repair? Are they driving blood sugar issues or not? So this can impact you. Okay. Once again, iron, if you've got anemia, that's going to impact you. Know where you're at. Because if you have a weak spot in your vestibular system or any of those systems we talked about, your vestibular, your oculomotor, or your cervical spine, then guess what? Having an issue here can predispose you to other things. Next that we want to look at is immune system, okay? When we look at what's important in the body, ultimately, I think it's all about the nervous system and the immune system. And if I had to pick which one's most important, and it's really, really hard, but whatever controls the immune system controls the outcome. Let me say that again. Whatever controls the immune system controls the outcome, because the immune system is there to help us ultimately live and how we respond to everything. So if we're shifted to inflammatory, that is a big issue. So what do we have in the immune system? We have autoimmunity. Okay. We have infections. We have allergies that can cause stuff. What are we seeing more and more of? Mold issues. Specifically the toxins that have been produced by the molds, the mycotoxins. These love the nervous system. That's a big, big thing. We have issues with the gut that can also drive the immune system. Now, a lot of these people who have dizziness, they ultimately end up having POTS, postural orthostatic tachycardia syndrome, or another type of dysautonomia, with POTS being the most common. So what's happening in the immune system? I hope you're figuring this out a little bit, right? Is that there's more than one thing that can go on. And this is why so many people who deal with dizziness, they don't get better. They bounce from one provider to the next. The primary care provider is like, I don't know what to do with you. Maybe you've got those ear crystals. Here, let's send you a PT. You do PT, you may get a little bit better. But if you're watching this, it's because you haven't. And you're like, dang it. Well, I thought it was that. I don't know what else. And you go to an ENT. I've talked to some ENTs. They hate dealing with dizziness. Like, unless it's a tumor, some infections, there's not a lot they can do either. Maybe they give you a medication to try to suppress your vestibular system, like meclizine, right? Maybe they think you've got anxiety, so they give you hydroxyzine. But they don't know. They don't like it, because we have so many biases. And as you've seen here, there's more than one thing that could happen. We have to remove our biases to get the help and the answers that we need with dizziness. We've got to know how to evaluate the nervous system, what's happening there. But we also have to know what's going to sabotage and ruin nervous system functionality. So it's what we've talked about. What's going to impact how well the brain produces and uses energy? What's going to impact the immune system within the body, and that ultimately can impact the immune system in the brain? What about blood flow and oxygenation issues, vascular issues? When you line up all of those, it's really, really rare that I don't see dizziness improve a lot. Okay? Usually goes away, but it usually improves a lot at minimum. And it's because we're not trying to find the one magic bullet. We understand that as humans, we have multiple systems in our body that have to work together for us to function the way we want to. Which means when you have multiple things wrong, which does happen, we are humans, then you have to be able to evaluate and address those to get the outcome you want. So I hope you found this useful. This was a very big deep dive more into the vestibular system, but we also did go into the other aspects of what impacts the vestibular system and ultimately neurological health. Till next time, this is Dr. Z. I'm known as the Brain Guy.